I'm Addison Smith with Campus Reform. What do students think about socialized healthcare, something that Joe Biden has argued for more of? How should the coronavirus vaccine be distributed when it becomes available? Should old people and people with pre-existing conditions have priority in getting the vaccine? And do they trust the government with that much power to call those shots? Moreover, will they trust the government with that much power after they find out that one of Biden's COVID advisors, Dr. Ezekiel Emanuel, wrote an article saying he hopes to die after 75? He doesn't see the point in living a long life. He says that he doesn't want to take antibiotics or vaccines. What's the point? He's lived long enough. Do they trust someone like that to have that much power over the healthcare system? Let's see what students have to say. Joe Biden made healthcare one of the key issues of his campaign, arguing for a more publicized, socialized healthcare. Is that something that you would personally be behind?
Yes, absolutely. Yeah.
Yes, 100%.
Yeah, of course. I mean, I think not being able to afford, healthcare should just be a basic human right. You know what I'm saying? Like, we should be able to go to the doctor. I should be able to get my Band-Aid if I need it. I don't need to be taxed out the wahoo.
I think that if you decide to have a country, you enter into a pact to try and take care of the citizens of that country.
I think that everyone deserves to have health care, and we shouldn't have to pay outrageous amounts for it.
People in America think healthcare is more like a luxurious item. If the government supports more fund to the citizen, then I think it'd be much more helpful.
Some good news about the coronavirus. There's a vaccine on the horizon. Pfizer says they have one that's 80 to 95% effective. Obviously, coronavirus is something that impacts older people and people with pre-existing conditions the worst. Do you think that we should prioritize them in mass distribution when it becomes available?
I do think they should have priority.
Yeah, of course. I mean, us young, healthy little whippersnappers, I think we'll be all right without, we can go a few more extra months of locking down and being courteous and wearing our masks and whatnot.
Yes, obviously they are. I think they should get more priority than the people who are young and then who are active.
Obviously, they're the people that are affected the most, and so I think that they should have the vaccine.
One of Biden's coronavirus advisors, Dr. Ezekiel Emanuel, he wrote an article for The Atlantic called Why I Hope to Die at 75. He basically argues that after 75, he doesn't want to receive antibiotics or vaccines or things like that because, he's old at that point. He's just kind of ready to call it and hoping that the death following would be swift and prompt. Do you think it's at all problematic that someone that would be leading a virus that impacts old people the most would have, those kind of views?
Yes, I do think that it's not great.
I mean, it's a little strange. It's kind of that's a hot take, I guess.
That does not make me a huge fan of him.
The paradox of it is kind of funny, but funny is not the right word. I don't know.
Scary, maybe? Come to think of it, it's kind of awkward because Joe Biden's older than 75 himself. One of the major criticisms of socialized healthcare is that, the government has all this power in saying who gets how much or who gets what, as far as vaccines and medicines go. The government would ultimately have the say in rationalizing and distributing healthcare and can reject certain forms of healthcare. Do you trust the government with that much power? Should we trust, someone who's espoused those thoughts with that much power?
Call it a necessary evil. I think that people should have health care.
I probably trust government more than the average American, I guess.
I mean, I think we're kidding ourselves if we don't believe they don't already have that power sort of kind of thing.
Does that concern you at all? Was a little scary even?
Not really.
No?
I don't trust the current administration in terms of having that amount of power.
I think it'd be better to trust the government. I mean, the reason that we pay tax because we trust the government, so...
We pay taxes because we have to.
Exactly.
I mean, yes, that is kind of a scary thought to think of, but again, I'm more focused on let's make sure everybody gets healthy.
I trust the government more than I trust private companies that are prioritizing profit.
You prefer the government get to decide?
Yeah. I think I'm not afraid of that,
Hey there, my name is Hannah Catherine Smith and I'm with Campus Reform. To continue seeing videos like these, be sure to subscribe here. And if you're interested in becoming a member of the Campus Reform team as an investigator or a correspondent, you can join the team here. And if you'd like to help us continue making videos like these, donate here.